Hi, my name is Rick Morgan. I'm with the RMT Academy, and today we're going to talk about new grad shiny object syndrome. I don't know if that's a real syndrome, but that's what I'm going to call it. And what this syndrome is I found that a lot of new grads over the course of my career in hiring and teaching, a lot of them want to learn all these techniques out there. Whether they want to add myofascial, neuromuscular, pregnancy massage, Reiki, um, all of the above. And the belief, the mindset, is that by adding these skills and these techniques, they will be more successful. What I have found over the years is that success is not built on what technique you are good at or what techniques you use. Mastery of any single technique is all you really need. Now, it's nice to have options, and I'm not discouraging you from continuing education, obviously. I think you should learn different techniques as time goes on. However, the biggest predicator of success, in my opinion, is confidence in your ability. What I mean by confidence in your ability is that you have a level of mastery, both intellectually and with your hands, and that conveys itself into the ability to confidently approach a problem, confidently to talk about an issue and how you're going to come up with a solution with your clients. So there are studies out there that have shown that for alleviating pain and getting people back to work from a low back injury or low back pain, they have found that Swedish massage is just as effective as deep tissue work. Since Swedish massage is the foundation that almost every school teaches you, it leads us to the conclusion that you don't necessarily need the deep tissue skills to help somebody with their low back pain, and in theory, any other pain issue. The differentiation is that you're actually really good at your Swedish massage, and that you're intentionally applying your strokes and your technique to a specific problem. Here in Virginia, where I'm licensed, new grads get a buy on their continuing education for the first renewal. So we have a 2-year renewal, and you don't have to do any continuing education for your first renewal. So you're basically giving 4 years before you have to do any continuation here in Virginia. The rationale behind that is that you have a boatload of knowledge that you achieved in your 550 plus hour course in order to get licensed. And it takes time to truly master that. In the art world, in music and dance and even any kind of hobby or skill set, studies have shown that it takes about 1,000 hours to master any given task. So if you want to learn how to play the flute, it's probably going to take 1,000 hours before you become proficient. I say master, but there's a level in that, to the point where you can play the flute proficiently. And of course, you can always get better and learn new styles of play and so forth. But the basic mastery of the flute should take somewhere around 1,000 hours, depending on the person, of course, and their innate skill levels. So when you come out of school, before you become really proficient, it's probably going to take somewhere around 1,000 clients. That's a lot. That's at least 2 years for most people. 100 clients a month is considered a really full schedule. So, but most people typically do 50 to 60. So you're looking at minimum of a year, probably more likely close to 2 years before you become proficient at what you've learned in school. And that, of course, assumes that you are actually paying attention to what you're doing every single time and trying to improve your skills. So with that in mind, if you're a new grad, I'm going to encourage you to work on the foundational level of skills that you've been taught in school. So what I want you to do is I want you to go back and hit those books, even though you just graduated. I want you to continue over the next year to refresh your knowledge of your anatomy, your physiology, your pathophysiology. And of course, as you're working with your clients, focus on developing your skills to the best of your ability. I know that's the last thing you want to hear, but once you've done that, and you can confidently talk to your clients without any hesitation about what you're going to do and how you're going to help them, then look at some specialties or some specialty techniques that intrigue you and pursue those. And once you've done those, practice for another year. So I hope this helps, and I look forward to talking to you guys more. If you have any questions or comments, please feel free to comment in the sections below. Thank you again.